And we're going to do quite a bit faster here because you all know what constitutes children with a disability. We only ask about it because according to ADA regulations, we must tell parents, we must offer at least 10% of our slots to children with disabilities. And it's solely to meet that requirement for Head Start, and not because we are trying to keep their child out or anything like that. Their response is voluntary and the information provided is confidential. Declining to respond to this question will not be used to exclude your child from enrollment. And there again, the 45 CFR Part 84, that is the act. And when we got those nice wire-bound performance standards, there was the dark blue one that was the performance standard, and then there was the light blue one that was the act. That's where this comes from. We can't deny enrollment to a child because of staff attitudes in accessibility. All of our Head Start sites should be accessible for people with disabilities, whether it's a child, a parent, or a staff person. We need access to additional resources, unfamiliarity with a disability or special equipment, or the need for personalized special services such as feeding, suctioning, diapering, toileting, and catheterization. Obviously, if it's something specialized, either that child would come with a nurse, or we would have to have training on how to do any of these things. If they're feeding, suctioning, or catheterization, typically they have come with a nurse that will help with that. But we do have some where they might have seizures, and there is, if they seizure for so long, there is medication that is given to the child. All those types of things we would have training before staff would be expected to cover that in the classroom. For us, a disability criteria is any child that's receiving special education services from the school via an IFSP, IEP, or triple IP, okay? So they are automatically counted once we get a copy of the IEP or IFSP. And Steph, do we get many IFSPs anymore?
She's coming.
She's coming.
Hi, we don't get a ton, but we still get them.
Okay.
You know,
Especially,
I think that it's like, because, you know, my dashboard does IFSP separately from IEPs. And
Yep.
I think we're just under the 10% if we were to do it program, you know, for each program separately. That we're at like 9% IFSPs for EHS kids.
Okay, yeah, IFSPs would typically be a child under the age of 3.
Yep.
Occasionally we'll get one for a child that's over 3, but it's less likely.
Mm-hmm.
They usually go to an IEP. So health impairment, cancer, diabetes, AIDS, rheumatic fever, lead poisoning, uncontrolled seizures, heart conditions. Blood disorders such as hemophilia, sickle cell, cystic fibrosis. Now these days we're more likely to get EBD than some of the other health impairments. Diabetes, now we've had a couple in the last few years, but even that one is not very usual or typical. When a child's behavior or emotional responses are different from the norm, that can fall into the EBD category. And it usually manifests itself as delayed social development, aggressive or self-destructive behavior, unhappy or depressed, excessive fears or anxiety. And there can be diagnosis of a serious emotional disturbance, or SED. We have more than we had 20 years ago, children that have just an EBD diagnosis, but it's still not real typical. We would more likely have a child that is diagnosed with developmental delay and behavior, and they're working on behaviors than the EBD. Speech and language, it can be stuttering, articulation, language, or voice. And one thing when you're sending in, like if they're on an IEP, it is handy to know if there's speech, which is just articulation, or language, which could manifest itself as they have difficulty processing information when they're hearing it. You know, they're don't have many words. They're, you know, so they're learning language. Speech and language can give them 2 different points. So if you say that they're just getting speech, I assume that that's articulation and they get 2 points for speech. But if they're also working on processing language, or it's one where they don't have very many words in their vocabulary, then it might be speech and language. So it's important to note both of those. And then mental impairment, Down syndrome, mild mental impairment, hearing impairment, with or without amplification. And some of the rest of these, autism, we're starting to see, you know, children that have more autism, which manifests itself usually with speech and language, and sometimes behaviors and other delays. And special needs, we consider it a special need if they don't have an IEP. So it is a concern that doesn't have to be a diagnosis, and it can be a concern from anybody. You know, it can be the parent is concerned, the grandparent, you know, maybe a Sunday school teacher has a concern about this child. You know, all those constitute special needs. They don't qualify for our 10% as disabilities, but it's something to keep an eye on. And, you know, sometimes if they're worried about their speech and language, we could end up referring them and they could end up in an IEP. Family needs, we've got single parent families, teen parent, and again, that teen parent doesn't have to be currently or with this child. You know, maybe this is their 4th child, and with their 1st child, they were a teen parent. That qualifies as teen parent. Divorce, ChemDep, health or dental needs, unemployment, blended family. And sometimes along with unemployment, I will look at underemployment, that, you know, maybe they're only working 10, 15 hours a week and they want to be working at least 30, 35. I will give them points for underemployment. Blended family, and especially with Hispanic families where they have a different way of giving the child a name. They might give the child the father's name or the mother's name, and it could look like it's a blended family when it's not. So I don't necessarily take for granted that I'm going to recognize when it's a blended family. So that is an important one to put down if they are a blended family, so that they get points for that. And do they have any children that are in out-of-home placement? It could be, you know, one of their older children is in out-of-home placement. not just this one. Or have they been, has this child been in foster care and now they're back with the family? That would also give them points. Any questions about family needs, special needs? All of these things, of course, would go on that last full page. And one thing I forgot to say, when you're handing in the application, it really is helpful if you start with the application and then behind that put the income eligibility sheet, then the income calculation sheet, followed by the documentation that you have that went into that calculation, and then the special needs. So that, especially when there's a lot of applications coming in, I go right to that back sheet to look at whether or not, and I'll whiz past the other ones and go right to that sheet to look for any points that I should be giving that child. So